So again, thanks to everybody for their active participation, great listening and comments. As you know, we're here to celebrate diversity and human variation. NIMAC is fortunate in multiple ways to now include Puerto Rico and the Virgin Islands. For those who have traveled there, you know it is a privilege to be connected to these jurisdictions more, to appreciate people, culture, natural beauty, and also share in addressing inequities and disparities together. I am delighted to introduce our colleague, Rosani Sanchez, who will introduce the panel who are the foundation of NIMAC's efforts to clarify and address emerging opportunities and expanding collaborations. Rosani Sanchez is the project coordinator at Family Voices National, where she focuses on organizational development across different projects that support underserved communities, inclusion in all aspects of family engagement and family-centered practices. She's a native Spanish speaker from Puerto Rico and the mother of twin boys. Rosani?
Good morning, everyone. Welcome to all of you that is sharing with us this morning. I'm gonna share my screen very quick. Everyone can see my screen?
Yes, that looks good.
Okay. Well, welcome to this session, Genetic Services Delivered in Puerto Rico and USA Virgin Island, current state, emerging opportunities, and expanding collaborations. Disclosures, myself, Rosani Sanchez, Coral Jimenez, Yvonne Peterson, and Brenda Figueroa, we don't have conflict of interest to disclose. Again, welcome to everyone. Family Voices National, in collaboration with NIMAC Regional Genetic Network, is currently working on an initiative to understand the genetic services needs in USA territories, specifically in Puerto Rico and Virgin Island. Our primary goal, reaching out to each territory, has been to understand the current situation regarding genetic services provision and easy to access for families in the context of each person's work and family circumstances. We are engaging and collaborating with stakeholders in families in Puerto Rico to understand the key barriers for families in accessing and receiving genetic services and the struggle that providers experience with reaching and serving families. We are developing a Spanish language training for families in Puerto Rico that will help families understand genetics and the services available, the resources and the support system that they need. This curriculum will be available to other NIMAC state teams in Spanish for speakers that speak Spanish and the other regional genetic network who may have similar populations. There are currently no genetic services available in Virgin Island. So we are reaching out families, providers, and other stakeholders to learn about the process used for screening newborns and to learn about the existing telehealth policies and about what families need more information on in order to access the services that they need for their children. Today, we have a wonderful panel that represents the current situation for families accessing genetic services in these two territories. I'm gonna start with Coral Jimenez. She is a mother of a teen with multiple conditions, including mixed-crossly, intellectual disabilities, and others. Has worked with the population of children with special healthcare needs since 2009, when she became family representative for the children with special healthcare needs for the Department of Health of Puerto Rico. Welcome, Coral. I will let you share.
Hi, Rosiani. Can you hear me?
Yes, I can hear you.
Okay.
Now you can share your screen.
Let me, whenever you're ready, I can start sharing my screen. Okay, I don't know if you can see it.
Yes, we're good.
Okay.
Welcome and tell us your story.
Okay, as Rosiani says, my name is Coral. I'm the family representative for children with special hurricane needs in Puerto Rico. I'm a mother of a child, well, a teenager of 16 years old. My pregnancy was completely normal. As I don't know if as any other mom, I had as many tests as I could have. So my pregnancy was very normal. I knew sooner than later that I was going to be a boy. So my life turned blue, my dreams turned blue, everything for me was blue and perfect because I was ready for my baby boy. I was expecting a room, everything like this. I was expecting, and then when Felix was born, everything became dark. My blue dreams stopped, my blue life stopped, everything stopped, and everything became dark. I describe it like I felt I was in a cave. I didn't know where to go, how to go. I felt like I was trapped when he was born. I was expecting a baby like this, a perfect baby, and Felix was born. And this was this first few days of Felix's life. Felix immediately went to the NICU unit in the hospital. The thing that was the most alarming to the doctors was his poor sucking and microcephaly. Then we discovered his head was turned only to one side, so it was part of the condition. In all the picture that we had, he was always looking for to the same side. So we discovered that he also was having problems, mobility problems. It was in the NICU for a few days, 10 days to be more exact. The first moments and months, I felt a lot of pain, guilt, and I want to emphasize on guilt because it was one of the most and strongest feelings. Blame with myself, with his father, with God. I blame everybody around me. I blame them because of his condition. I was angry with everybody, including God. Dual, I describe it, I put it as dual because I felt like I lost my baby, my healthy baby, my basketball, baseball player baby. I felt like I lost it in that moment. I felt like they destroyed all those dreams. So I described it as a dual. And most of it pain. It was a very physical and real pain. I could say that above all that, the most intense feeling was love. Love like I never imagined, love like I never felt before, love like I never planned you could feel for somebody else. There's no way somebody could prepare me or describe me what I felt when my son was born. So there is my animation for the love that I'm very excited because I thought this was a great job for me. This I left it in Spanish because I'm not gonna go through it a lot, but these were all the services that Felix needs, and he still will need through his life. Pediatrician, early intervention, cardiologist, oxygen tank because he was having seizures for the first few years, therapies, EEG, CTs, MRIs, all of the services. Felix needed them and still needs some of them. I was lost. I didn't know the word, house, or who. I was overwhelmed. In Puerto Rico, we have a situation that we have limited availability of pediatric specialists. As Rosiani mentioned before, it's one of the challenges in Puerto Rico, as I heard in the Virgin Islands. For example, neurology, physiatrists, therapies, all kind of therapies. The availability of the specialist is very limited. And the most challenging is the geneticist because we're in Puerto Rico. So for all of you or some of you that don't know where Puerto Rico is, Rosiani already had a picture. We don't have a way to go. If you go south, north, east, or west is water. So we cannot go to another state or to another hospital to get services. So genetics was one of the main challenges. At that moment when Felix was born, in 2005, there were only 4 at the moment. 3 of them were completely private practices. 1 of them was in medical school. And the waiting list for the one in medical school, which was the one who was not private, it was probably 1-2 years in a waiting list. If you want to go to them on a private practice, the cost of the appointment, it was inaccessible, and it's still non-accessible for many, many parents. So the labs is another challenge. No enough labs to run the tests that are ordered by the geneticists, or that we need to realize to know what our babies or our kids are having. The cost of the labs is outstanding. Most of them are not covered by medical insurance. So I know of parents that they have to be selling cakes or collecting money to be able to pay for the labs. And me as a mother, I think no parent should be having to sell cakes or do activities to collect fundings to get medical services for their child. Looking for answers, and looking for our where, how, or who, we end up going to Johns Hopkins and Kennedy Krieger. We had the privilege that we could go. We had to charge everything to a credit card and go. So we had to go to Kennedy Krieger and Johns Hopkins because here in Puerto Rico, we didn't have the access. It was easier for us and faster go to Kennedy Krieger and Johns Hopkins than to get the services here. Thank God for credit cards, because we put everything on a credit card because we couldn't afford it. Then the first chromosome came. They found a deletion on his first chromosome. We didn't know what was that, still don't know, because there is no other patients with the deletion that he has on his first chromosome. What changed when we went to Kennedy Krieger? We get our where, how, and who. It gave us a more clear idea what was going on. It gave us a why. Finally, we get a why. I stopped feeling guilty. I stopped blaming his dad and everybody. I stopped blaming the did's and didn'ts, because I did blame something that I did or didn't while I was pregnant. So that stopped when we went to Kennedy Krieger. It gave us a map to follow, and we knew we were on the right track. When I said I stopped fighting giants and I stopped feeling guilty, because by knowing that my son has a genetic disorder, it gave me the peace that it wasn't my fault. All the time before that, I thought it was my fault. I thought it's something that I did, something his father did, something on my blood, something on me was wrong, but we stopped feeling guilty. And I think this is very important for the parents, knowing that when a baby is born with a genetic disorder, it's not their fault. We still need information, we still need guidance, we still need lots of support. Felix needs support for the basics, for the pool, for going into the water. He needs many hands to do the basics, but everything gets better. That's the message that I want to leave, that the families and the professional, everything gets better. It's a tough road, but everything gets better. That's Felix on riding horses on his therapy. This is a very nice, important picture for me, because it's a picture when he was starting to walk, when he was like 3 years old. And the other picture, it was the first time that he went to a regular school with his assistant. So there is been a transformation in his life and in our lives. And let's remember, it's not easy, but it's not impossible. We need support. We cannot do it alone. Parents, we need the support of the professionals all the time. It's not a paradisiac life. I think sometimes I, as a mother, feel the pressure that people think I breathe glitter and I'm floating in a pink cloud all the time because I'm strong, I'm undefeatable, and it's not a paradisiac life, but it brings a lot of happiness. We might cry again. Every day is a challenge, but every day is an adventure. And the important thing, I will also want to leave the parents and everybody, this is not a race about winning, about being right, about being first, about anything. It is not a race. We all can make difference. We as individuals, we all can make a difference. Parents, professionals, doctors, nurses, everybody has something unique to contribute. One thing that I always practice myself, pain might teach us a lot. Let's not try to escape from it. It will teach you a lot if you're able to learn from it. We cannot leave a mark, good or bad. Let's try to leave a smile, a nice memory in the people. When I think about Kennedy Krieger and John Hopkins, I remember with a smile. I had a great, great, great experience. So let's leave a smile. Let's leave a nice memory. Let's think about the kids first. Sometimes we as parents and professionals, it's been my own experience, we're in this competition for who's right, and we forget about the children. So let's leave a smile, a nice memory, and think about our kids. Let's make a difference. There's all of obstacles, but we need the support, we need the guidance, and we as parents need you professionals, and you professionals, I can guarantee you, you need us to be part of this team. In Puerto Rico, as I mentioned, there's a challenge because the lack of professionals, the transportation in Puerto Rico, as you saw on the map, most of the services are concentrated in San Juan, which is the capital of the island, and the transportation is either not existent or very expensive for families to drive from the rural areas. So we need to make a difference. And that, I think that will be it from me. Thanks. Gracias a todos.
Wow, Coral, that was very powerful. Thank you for sharing your story. I mean, you was on point on so many things. So thank you so much. I mean,
Thank you.
I really got emotional. So thank you.
Thank you for
Very
the
proud of
opportunity.
you.
Thank you.
Yes. We're gonna have some time for questions at the end, but we're gonna keep moving to our second panelist. Her name is Yvonne Peterson. She is the Territorial Executive Director of the Virgin Island Developmental Disability Council, and she also is the Program Director for the Family to Family Health Information Center of Virgin Island. Welcome, Yvonne.
Yvonne, thank you so much for taking the time to be here. We're very happy that we're going to be able to hear from you, especially about sickle cell and what sickle cell means. And I remember in one of the many conversations we've had over the past couple of years, you were talking about how sickle cell is scary. So tell me a little bit about that.
Yes. I first heard about sickle cell when I was by my mother's house, and I remember being at the dining room table and seeing her talking to one of her friends, and she said, "Well, you know, Yvonne has sickle cell." And I turned around and the way she said it, it made it feel like something to be concerned about. Her tone, and from then, you know, I was a young child. I was very, you know, I kind of absorbed a lot of stuff, and from then I started to think about sickle cell. And then I heard other family members have sickle cell trait, and it stuck with me. And I remember when I was getting my daughter, I asked, "Do I have sickle cell?" Because that was a concern of mine. Because I studied it in the library and I heard about what it means. I would go to the library. A lot of times I just go to the library and read books. And one of them was to read about what sickle cell was. And so I was always scared and always was concerned about what I'm eating, would it affect my sickle cell, would it cause me to die and things like that. So that was really a concern of mine.
So that's interesting that you said that you were, you know, when you were having the conversation and you were little, you were like 8 years old and they were having this conversation, you're afraid that your life expectancy is affected by this. Yes,
the tone, you know, is like, well, she has sickle cell, like, and I was like, wow, you know, oh, poor little girl.
What evidence did they have to say that you had sickle cell? And did you have sickle cell?
No.
You didn't. And so what do you think they were basing that on?
Either maybe they got confused with sickle cell trait, or sometimes I think they said when I was smaller, I would get sick. I guess because you get sick means you must have sickle cell. I didn't really know why, but it seemed to be is that if they felt you was get sick or something, that means you must have sickle cell. I don't know whether or not there was ever any testing done, but that's what I was told that I had sickle cell.
Right, right. And so, and then it was, you had this fear within you until you had, your daughter was born.
Yes.
And you asked in the hospital, do I have sickle cell? Does my daughter have sickle cell? How
Yes.
did that transpire?
The midwife, she was a family, I mean, she's close to my aunt who was also a pediatric nurse. And so I called her in confidence and I said, I'm scared because I thought I have sickle cell. I have sickle cell. Is going to happen to me when I deliver, when my child have sickle cell. And she said, I didn't have sickle. She said, well, I guess with the test or something, she said, I didn't have sickle cell because they would have known from coming to to get my checkups out every month. Mm-hmm. But I just felt that way and I was just scared.
Did they ever test her for sickle cell at birth? They did?
Yeah, she didn't have it.
She didn't have it. And when did they tell you that she didn't have it? Or was it when you had the conversation with your family that you?
Well, after she was born, I don't remember exactly, but I know after that, I was told that she doesn't have it. I was like, shh.
Mm-hmm. Okay, so you were told at some point after she was born that she didn't have it. Did you ask, or did they volunteer the information?
I asked at the delivery time. I asked about it, and then when she was born, I asked again.
So that was the experience. So what you said is that there's this fear, and that people feel that family around you were identifying traits in you and in other people. It seems like it was something like, oh, you might have it. But there was really, at that point, there wasn't a test involved. And so you had this fear because people thought that maybe you had it up until you were an adult woman who gave birth to a child. And then, you also shared another story that was more recent, it feels like, or from a cousin or a family member who died when he was 4 years old of sickle cell. So can you tell me a little more about that?
Well, I know he's a family member of my daughter, also I think indirectly with me. And I remember when he was small, he would always be going to the hospital. I think I was maybe 19 years old. No, maybe I was about, how old was I? I must have been very young, till 19, 20. And I was heard about him all the time that, he's sick and he had to go to the hospital. And I think they used to give him blood transfusion. But there was always this cloud, like how long would he live? Mm-hmm. But it seemed to be that the perception is when you have sickle cell, you're more likely to not live very long. That was the impression I got. Mm-hmm. And I remember when he died, and he was so small, and they had him in a little coffin, and they said, he died because he had sickle cell. That's what I remembered. Very much so. And I was saying he's so young, and I was wondering why so young that sickle cell you have to die. And I remember the same thing when I had my son. My son act the same thing with my son, because you test to make sure my son doesn't have sickle cell. Mm-hmm. So it just seemed to be. I only know that I'm working with Family Voices. It seemed to be I'm having a different understanding of what sickle cell is about. In fact, last week or so, I talked to my sister, and I'm saying I'm going to be talking about sickle cell. So you have sickle cell? I said, no, I don't. You don't? They didn't even know I didn't have it.
Right.
My sister.
Your sister said this and just recently.
2 weeks ago.
And it was interesting because when you and I, Yvonne, were talking about this interview, about doing this, you said, well, I didn't know that treatment and all this existed up until a while ago. And you said, and I asked you, well, when was that? And you said, our conversation, right?
Yeah.
2 years ago when
Yeah.
when we met each other, in St. Thomas and St. Croix, that's when you told me that you learned that sickle cell could be treatable.
Yes. Oh, yes. I was shocked. I was surprised. And I feel kind of not embarrassed, but kind of you expect that someone with an education should know, but sometimes you hear things and it stays in your mind and you don't question it and you just accept it. And there's no reason for you to explore it because when I found out I didn't have sickle cell, I was just relieved. And that was
Right.
enough for me at the time.
Absolutely. Yes. And there's no embarrassment, right? Because one of the reasons that we're here is to understand that your knowledge of sickle cell, the knowledge of their family of sickle cell, and the really depends on the efforts to educate and to
Yes.
disseminate information. And
Mhm.
so what do you think should be, what would you wish for someone in your position as a young mother, as a young girl, um, could know to not be afraid or to have more control over that?
Well, one of the things is that I know that, from my understanding, sickle cell is something that passed mostly in the based on race. Black people have more likely to have sickle cell, correct? Yes.
Yes.
And I think that if when you have a test or something and there's more understanding about it, there should be some way that um, when you go to the hospital, you go for a medical checkup, or things like that. There's brochures or ways that people can learn about sickle cell. There can be some more outreach that sickle cell is not a situation where is the end of your life or you have less time in life because you have sickle cell.
Or
And
if
also
treated, right?
there's
That I think
treatable.
the main thing is that it needs to be
Yes.
identified for it to be treated, right?
But also too is to have more services in the VI because I met a lady who had sickle cell and she seemed to be going away for treatment. So if let's say the Virgin has a percentage of sickle cell, we need to have more services
Mhm.
locally or at least maybe in Puerto Rico something that making sure that those who may have it um, gets the services that they need. You don't have to go all the way to the mainland to get
Right.
treated.
Yes. So several things you're asking. So one is you want to learn more about it, more
Right?
information to be readily available. You want flyers, communications, learn
Mm-hmm.
about it. How and when it's identified. If it's newborn screening, then learn what that does, learn the results, but also learn that when it is treated, that it doesn't mean a death sentence, but also treatment that needs to be available in the Virgin Islands, that you don't need,
Yes,
and you said either the Virgin Islands or Puerto Rico, but really
Puerto
we
Rico,
want it in
yes.
the Virgin Islands, right?
Correct.
That
Based on
there's
the cost, yes, yes.
what else, Yvonne?
Yes, that we have people trained like from the Family Health Information Center, um, navigators to at least someone, so few can learn as much as they can about sickle cell. So we will be like a source of information. A lot of times too, people will not be comfortable talking sometimes with a directly with her a service provider. They may be more comfortable to talk with somebody else initially so that they don't feel like asking silly questions.
Right.
That's important. I think that's important.
Great. That's great, Yvonne. So you have identified some really important pieces, via your story of needs for education, understanding of how treatment and timely treatment can address the fear that you've identified happens within your community of sickle cell, of the uncertainty of whether someone in the family has it or doesn't have it, and the people who have had it, whom you have watched around you pass away from it. Their lives have been curtailed, and also the ability of centers like yours, the Family to Family Health Information Center of the U.S. Virgin Islands, and the role that the family navigators have in helping to disseminate that information. So this has been great. Thank you so very much, Yvonne.
Yes.
And I know people will have a lot of questions for you, and you will be here in the rest of the session to hear and answer some of their questions.
Thank you.
Well, thank you, Yvonne and Maria Isabel, for the interview. We do have Yvonne in our session today. For the end of the session, we will have the opportunity to ask her questions and to share more information. Let's move on to our last panel. Her name is Brenda Figueroa. She is the director of the Family to Family Health Information Center of New Jersey and New Jersey Statewide Parent to Parent. Brenda is a graduate of Partners in Policy Making 2017. Her most important role is to be a mom of two young men with disabilities. Brenda believes in the power of inclusion, high expectations, and informed parents. She has successfully advocated for her sons, and she is currently teaching them to advocate for themselves. Welcome, Brenda.
Yes, hi, can you hear me?
Yes, and we can see your screen as well.
Yes, hi. I'm sorry, everyone, I can't share my video because of connectivity issues and I don't want to play with the system. So, um, good afternoon. I guess good morning, everyone. So, like she said, my name is Brenda Figueroa, and I want to share a little bit of my story, my family story, and our journey, not just in the genetics world, but from Puerto Rico to New Jersey. So, a little bit of background information. My kids and myself, we were born in Puerto Rico. All of us actually were born in Mayagüez, Puerto Rico. We are from Aguada, a small town in the west. So we are not from the capital. We are not anywhere near the metro area. And that also plays a little bit into our story. My oldest son, Norberto, is on the spectrum. He was diagnosed at 2.5. I was very fortunate to get that diagnosis so early, um, because receiving that diagnosis was a challenge in itself. My youngest son, who's 20 years old, they're only a year apart, Khalil, has been diagnosed with ADHD, severe dyslexia, unilateral sensorineural hearing loss, sensory processing disorder, and now some mental health issues that include depression and anxiety. When I was trying to get Khalil diagnosed, I was told by professionals that I was losing my mind, that because I had a child diagnosed on the spectrum, I was looking for something to be wrong on my youngest child. So that was something we had to struggle with. There was genetic screening on both my children when they were born. That is something to be aware of. There was, however, no newborn um, hearing screening at that time. It wasn't until a year, I believe, after Khalil was born that that process started in Puerto Rico. So after the diagnosis, immediately, because Norberto was diagnosed on the spectrum, there was sort of an autism protocol where it was a direct referral to genetics. That is why we were fortunate to be referred to genetics, because it was part of that protocol that the team had developed. However, wait times were long. If you were going to see the clinic, there were only, I believe, two or three doctors at that time. And the one that came to Mayagüez, which was 30 minutes from where I lived, would come, I think it was once a month. So wait times were really high. We decided to go the private route and pay out of pocket and go to the private office in Ponce. Um, and that appointment just took a couple of months, but everything was out of pocket. And we were fortunate that family helped pay for those services. um, so we could pay out of pocket. Um, During that protocol, genetics testing included the siblings. So that is why my youngest Khalil was also included in that protocol. And uh, they ruled out fragile eggs, did a lot of chromosome metabolic testing, um, never picked up necessarily on anything. Follow-up appointments were then at the clinic, and because the wait times were so long and we then decided to move to New Jersey, I believe we only went to like two appointments in the Mayagüez clinic. Now, keep in mind, like I said, it's 30 minutes from where I live. Um, you had to figure out how to get yourself there if you didn't have a car. Uh, that was not necessarily a barrier for me, but I know it was a barrier for a lot of families because in that area there was no bus system and no real uh, taxi cab system as well. So in 2005, we decided to move to New Jersey. Uh, not necessarily because of lack of medical care, but it was mostly the educational services. It was really difficult in our small town um, to find the services that my children needed, and services that were also inclusive. Everything was very isolated and segregated, and that's not what I really wanted for my children. A lot of services with therapies and evaluations we were able to receive, but I always had to travel to different towns. So even though I'm from Aguada, the therapist was from San Sebastian, the ABA specialist was from the metro area, and I had to travel over there, or she would charge me triple to travel down to Aguada. And keep in mind, travel is an issue because if you're traveling 2 hours away with children that can't speak yet and tell you their needs, um, one that has severe motion sickness, and it was just very difficult to maneuver. And mind you, we're talking about a 3 and a 2 year old, and it wasn't so simple as just saying, okay, I have transportation, I can also get myself there. But like I said, many times I know many families that this transportation issue was huge in Puerto Rico. Oh, and back then, I don't know now, but there was no such thing as a GPS. So that was another tricky situation. Um, when we moved to New Jersey, the referral to genetics was very automatic because they had already received the service in Puerto Rico. So the only difficulty was it took me over a year to get that appointment. The lucky part was everything was covered through Medicaid. So even though we had to wait for a whole year, everything was covered and nothing was coming out of pocket yet. So again, we went to the genetic services, nothing came up, and we were told to maybe in a few years as genetic testing became new tests were developed or things were improved, then maybe we would come back and revisit other types of testing, but nothing really hit. Now, it is important to understand that my youngest child did not get diagnosed with his hearing loss until he was around 8 years old. So in 2017, when Khalil was going to one of his regular ENT appointments, we were seen by a new doctor. And this new doctor, who initially I was a little bit skeptical, she looked fresh out of college, and uh, my 17-year-old even, got all flustered because I guess he found her to be beautiful. Um, I didn't think I was going to get much out of the appointment, and that's what shows you we should never have assumptions. She immediately started asking about the family history, curious to see that Khalil was diagnosed later in life with the hearing loss. And she connected some things in the family tree, and she referred me us again to genetics. And this time it was to rule out certain genetic disorders, including Alport syndrome. Now, this was a really bad couple of months because I needed that appointment to be sooner rather than later. As soon as I read about Alport syndrome, I mean, there was so many things to be worried about. And given the fact that their dad struggles with kidney issues. It was a stressful time. Now, the reason we didn't have to wait a year is because it's always about who you know, and there was a mother there at the genetics office that was able to keep an eye out for anyone who canceled the appointment, and she gave us an appointment, and we were able in a couple of months to see the doctor and send Khalil up for a lot of DNA testing and other things to rule it out. um, we also had to go through a couple of labs because none of them could get straight and do the proper testing from the get-go. So there were certain assumptions on my part. I thought we moved to New Jersey, everything's going to be way easier than than in Puerto Rico. That was not necessarily the case. I also assumed everyone knew about genetics, and I quickly realized not a lot of parents knew about genetics, especially as I started working with family to family and parent to parent. I realized that no, a lot of people don't know about genetics. So that was an eye opener for me. Um, the other thing is, some specialists were surprised about the level of care I had received in Puerto Rico, but keep in mind that I have always been very, I would advocate forcefully. Some would even consider it off-putting sometimes. I know that's something about myself, but the other thing is my kids' issue weren't necessarily um, the impact was more educational. At some point, it became more educational than medical. But I do know that it is an issue in Puerto Rico. Some of the barriers are the same when it comes to wait times and transportation. And in terms of education, educating the parents to understand what genetic services are, and also professionals so they can understand to make the referral. Um, because a lot of times, while I did receive the referrals, I literally had to beg for those referrals. So that's kind of a gist of our story. I hope it helps anyone who's listening. And those there are pictures of my kids. They're not just their diagnosis. As you can see, they have a full life of their athletes, volunteer firefighters, and they're learning to advocate for themselves. And I'm very proud of how far they've come along. Thank you.
Thank you so much, Brenda. I mean, thank you all of you for sharing your story. I mean, just listening to you guys, we can clearly see the struggles and the challenges that families are going through, not only in the territories, because Brenda has some challenge in US as well. And this is a big lessons for us. And as we sharing this forum with many other professionals and specialists, I mean, this is what families needs. We need more providers. We need more informations available. We need services and resources available. I mean, we're lack of transportation. I mean, referrals. I mean, you name it. So I'm very, very glad that we had the opportunity to share your experience in life. I mean, it really touched me. And I mean, I know that you guys went through all the challenges that each of you have go through with their children's, but I really got a clear message of hope, a clear message of a strong women's that they can develop and help their children to overcome those barriers, and each of you have shared that. So thank you so much for passing that to us. It was very, very powerful. um, do we still have time for questions?
Yes, you have 15 minutes.
Okay. I Let me see the chat. I mean, if any of you have one specific questions for any of our panels, you can go ahead and ask yourself or just put it in the chat. We're getting really good messages. Thank you. That was a great session. Thank you, all of you. Any questions?
Would you like me to bring everybody up so you can talk with the panel?
Yes, that would be great.
Okay.
If the panel would like to share any other information, we have some time.
I see, Rosani, hi. I see that there's something in the chat. Brenda, what tips would you give other parents who want a referral for genetics that are having to fight for it? I think, well, like I said, I've been called very assertive and aggressive, but squeaky wheel gets it first. So I was very adamant and I kept calling. Do you have a canceled appointment? Do you have an appointment? And with the doctors, especially when you need the referral because you can't just go directly to the geneticist, I think documenting, one of the things I remember I started doing in Puerto Rico and helped when I moved to New Jersey was I had a binder with all the documentation. And every time a doctor said or questioned, because that was one of the things I was questioned, oh, he doesn't look like he has autism. I would take out my binder and say, okay, look at this, look at this, look at this, look at this. And they would be like, oh, okay. And that's when the referral would come in easy because they knew, okay, wait, let's take a better look. And I think that, that was one of the things that at least was helpful for me. The other thing that I did want to add, my kids are adults, 21 and 20, they're adults. But when they started transitioning age, which for the education system here in New Jersey is 14, but 16 nationally, I started including them in the appointments and asking the doctors to acknowledge their presence and ask them questions and include them in the appointment because that is important as they become adults with disabilities who will be advocating for themselves. So that was one of the other steps that I wanted to make sure we pointed out. Doctors need to acknowledge and start asking the questions to the best of their abilities. Norberto still has a huge communication problem, but the doctors will talk to him and find a way to get those answers.
I think you mentioned something very important is how families and parents can prepare themselves when they go to see a specialist. I mean, the binder is such a big and useful tool for families when they go and see, and especially when they don't have too much time with that specialist. So I think that's very important for families that they're here listening to all of you. That's a great tool to go for.
Yes, Rosiani, in the same line as Brenda, thank you, Brenda. When she was talking about the binder, sometimes I recommend families, besides having it in paper, I have an application on my phone, which is a scanner application. That I take pictures of all the documents, all the results, even the labels of his prescriptions and medications, because sometimes I'm so nervous or whatever that I forget his medications. And I take pictures of all the documents, everything, and I keep them in my phone with this application. In my case, this is not, I use one that is called Cam Scanner. So I have everything in my app. I take pictures of everything. The application converts the document into a PDF and you can save it. Sometimes it's easier for me. Either when I go to the doctor's office, I try to have copies of some of the documents, or I can email the information to the doctor. So the binder, as she says, is an excellent idea. One thing that I do, and it's my personal technique, is I become friends of the secretary in the office. The secretary in the office can be your best friend. So try to become friends or be friendly with the secretary. She might be your key to go into the office, as Brenda says. Sometimes she will get tired of listening to you calling every single day. So she might sometimes give up and give you the appointment. And one thing somebody asked about in Puerto Rico, we're working with the telemedicine services in Puerto Rico. We're still in the process of doing it through the COVID-19 funding. We did get telemedical services. We are still in the process because of the law and the permissions that we needed. But we also have coordinators for all the screening that the babies goes through in the hospital. We have in our program service coordinators for hearing, hereditary, metabolic conditions. We have different coordinators. In Puerto Rico, by law, all the results come to us in the department, and we get access to these results. And these coordinators, some of them are social workers, contact the family and take the family step by step in what they need to do, making appointments, coordinating services, explaining the family in a familiar, and we call it in Puerto Rico in the rice and beans language, in an easy language that everybody can understand what's going on. That was not when I was born. My son is 16, so I agree with Brenda. It was not for me when my son was born. And the early hearing detection, it became law in 2003. So no, when my son was born, those services were not available, but now we do have coordinators, and they take the family step by step by the hand in whatever they need related to this test when the babies are born, the newborn screenings for the babies.
That's great, Coral. Thank you so much. Yvonne, I know that you're sharing a story in the chat. Would you want to share with everyone? You're muted.
Yes, I was telling a family member I'm going to be on this conference, and I was just finished talking about the sickle cell, and the family member said, I have sickle cell. I said, no, you don't. So is this, and I said, no. I says, why would you think so? But it seems to be is that there needs to be more education about sickle cell, because the minute you have a family member have sickle cell, it gives the impression that has like a cloud over the entire family from throughout. So it seems to be something that needs to be addressed. And I was just thinking that I take the person for the last 12 years, no more than that, to the doctor every time. And only until that 2 nights ago that was brought up. And I said about sickle cell. And I was like, no, you don't. I've been taking to the doctor for 12 years. But somehow along the line, when it was young, they was saying, my family has sickle cell with me, you're going to have it. And so it becomes like a norm to be thinking that you will have it. So that kind of,
Yeah, and we go back to the lack of information from, overall, that the families, they think that they have something, but they don't have also the specialists to confirm a diagnosis like that. So yeah, families just expecting that they have it. Maria, you gonna say something?
Yeah, so Yvonne, thank you for sharing that, and everyone, thank you so much for sharing. I know there are some questions in the chat that I wanted to bring up because they had to do with what is available or what is being done in Puerto Rico and the Virgin Islands. And so one of the things that I wanted to share with you that we have learned over the time that we've been working with these two territories is that they're both very, very different. The only thing I think that the U.S. Virgin Islands and Puerto Rico share is that they're in the Caribbean, that they're beautiful, they have amazing people, and that they're territories of the U.S. But so they are very, very different. And now that we are in the needs assessment phase, that NIMAC is in the needs assessment phase, is the time. I know, Karen, you were asking. So it is one of the reasons behind this panel is for everyone who is listening to think about how you can establish collaborations that would move things forward. For example, with Yvonne, we were talking about the services that this person who had sickle cell and had to leave the island because she didn't have anyone. She's actually in the British Virgin Islands, I came to find out, right now getting services. So telemedicine is very different in the US Virgin Islands from what we learned than it is in Puerto Rico. Yvonne, can you tell us a little bit about what happens with telemedicine in the US Virgin Islands, and what are the, I guess, the roadblocks behind being able to receive services from the continental US in the US Virgin Islands?
Muted.
well, I know as of now, the unstable internet service. I think that has increased in the last couple months. We don't have AT&T anymore, so we have another company. And in fact, this morning, I couldn't get on to the internet. In fact, for a while, I could not get on to the conference. So the instability of that is important. Another area now that's important, which was helpful because of now having the CARES 2 grant, is to develop telemedicine services more in closer to where the families are. Because let's say in the island we have transportation challenges, if someone needs to get telehealth services, they may have to travel maybe an hour or so to get somewhere, to get access to the computer and the services. So that's another challenge. And so I think those are the issues. One is the fact of the instability of the internet service. And the second thing is the transportation. And also too is that the what is it again, the confidentiality. Sometimes people don't want to go somewhere where they don't have the access to have something where it's secured, where they can know that they can discuss their telehealth services in a very private area. I think that's another challenge. So that's why we're working with Family Voices to do that in the 2 islands.
And Yvonne, another piece that I think would be useful to speak about. So we know that there aren't any genetic services providers in the US Virgin Islands. And so I'm sure that many of the people listening here, as we have had in the past, are saying, I would love to do that. I would love to be one of the providers for the islands. So we know that there are some regulatory roadblocks to people from the continental US providing services.
Yes, I from my recollection is the costs. I think we're trying to get service providers who are outside the territory, medical providers, but I think there's an issue regarding the licensing and the cost of providing a service here on a basis like this. So I think that's one of the challenges. How do we make sure that we can get the services we need, but it's not in a level where it's not cost effective for the service providers? I think that's something that needs to be discussed with the legislature on the health committee, health and services, to see how that can be addressed.
Thank you.
Well, I think we have to move on to the next session. That I'm correct, Joanne?
Yeah, we're wrapping up. It's been terrific, and I don't want to. It's always hard to be the timekeeper, but we have to do that.
Yes, thank you so much to all of you to share your experiences. I mean, for me, it has been a wonderful session. So thank you all so much.
Well, thank you for the opportunity. Thank you, Yvonne, Maria Isabel, Rosiana, Brenda. Thank you very much.